often wonder why root canals cost so much. And how does a patient ensure that he or she is getting the best treatment? I've seen people opting for removal of tooth rather than getting a root canal done as they are cheaper. And we can see social media pushing lots of DIY dental trends like natural remedies for cavities or natural remedies for tooth pain. So what's your take on this?
I've seen patients where beautiful root canals are done and they neglect once the pain is gone and then they don't return. They return when the filling is gone or either they break their tooth completely. No amount of artificial material is going to replace your original tooth. So I've seen patients putting on Zandu balm on your teeth for tooth pain. Don't bargain too much, and fast, good and cheap. Only two things can come at once. If it is fast and good, it won't be cheap. We have to remember that.
Hi everyone, I'm Dr. Yashashwini. Welcome to the first episode of mine. As a dentist, I've always been passionate about educating people on oral health because many people have limited knowledge about it, and I always wanted to change that. So this podcast is my way of spreading awareness on health and other life sciences. So today's guest is someone truly skilled in the field of dentistry, Dr. Reshma Nooryne, specialized in endodontics, who has dedicated her career from handling most complex cases to staying at forefront of advanced procedures. So you all must have visited dentist at some point, but do you know who's an endodontist is, what exactly they do, and when and why you should visit them? So this episode is all about it and packed with insights you don't want to miss. Hi Dr. Reshma, welcome to the podcast. I'm very thankful that you're here. It's amazing to have someone I've known for so long, right from our undergrad days to now excelling in our careers.
Hi, Dr. Yashashwini. I'm so glad you've invited me, and I'm honored to be here and share my knowledge. And yeah, we go way back to undergraduate days. And then never in my wildest dreams I've thought that we both will be doing a podcast here.
Yeah. And you know, when I thought about this podcast, your name was the first that popped into my mind because I've seen how dedicated, passionate, and skilled you are.
Thank you for such kind words.
So, Dr. Reshma, people are familiar with dentist, but endodontics is a specialized field. What made you choose this specialty over other specialties?
So once you do your bachelor's, which is Bachelor of Dental Surgery, you become a general dentist. Once you do your master's, you become a specialized dentist. So what I have specialized in is conservative dentistry and endodontics. There are 9 other departments, but this department is the bread and butter of dentistry, and also I'm very passionate about it, and I'm also in it because of the money. And out of 7 out of 10 patients that walk into the clinic needs these procedures. So that is why I'm into it.
I know you worked hard for it and you're living the passion you always wanted it now. So, many people believe that visiting a dental clinic automatically means spending a lot of money. But in fact, dentistry is not expensive, but the neglect is.
Absolutely. So ideally, you have to consult a dentist every 6 months. So let's be honest, people don't do that. They don't go to a dentist unless and until there is a lot of pain or discomfort. So all this is because of the notion that we have 32 teeth and losing 1 or 2 won't make big difference. So what I would suggest is, when you have some discomfort over a week, please go visit and fix it up. And as small as food lodgement can cause you discomfort. So this can happen because the tooth is breaking down, because it is getting rotten and it is breaking down. So once you get a filling done, it will be cheaper and will be done with minimal prices. So if you neglect it, it will become wider, which will need an inlay, which will be double the amount. Then if you neglect it even further, it will need root canal, as the infection will go to the pulp. So you'll need to follow it with a crown. And this can be 10 times more than what filling is. Once the tooth is completely destroyed and only the root stumps are remaining, you need to get it extracted and follow it up with either bridges, which is also called as fixed partial denture, or implants. This will cost you more than 20 to 50 times of that of the filling. So fix it up as soon as possible. Yes, dentistry is not expensive, neglect is. So no amount of artificial material is going to replace your original tooth. So please do take care of what you have in your mouth as of now.
Yeah, always prevention is better than cure.
Exactly. So all you have to do is brush your teeth twice. If you're lazy, get a electronic one or the battery operated ones. If you're lazy to floss, get a water flosser. Please rinse your mouth. All these small steps will lead to good oral hygiene in the long run.
I think a lot of people will relate to it, and also this is a very valuable information. This reminds me of a case where a mother brought her 10 years old kid to a clinic. So I was the one diagnosing that time. So the kid had just one cavity which just need a filling. But the mother said she'll be getting back tomorrow, and she didn't show up. By the time she came to the clinic, it was 6 months. And then the kid needed even more extensive treatments.
Totally relatable.
Yeah, yeah. So people often wonder why root canals cost so much. So can you just break down what expertise and equipments go into these treatments?
Okay, let me explain something. So, tooth has two parts, which is crown, which we can see in the oral cavity, and the root, which is in the bone. And it has three layers, which is enamel, dentine, and pulp. Once the caries travels from enamel, dentine, and it reaches the pulp, it causes inflammation, irritation, and all sorts of symptoms. So, we have to perform root canal. Root canal, let me break down the steps for you. Root canal, first you drill the tooth, and once you drill the tooth, you open it up, and then you can see something called as canals. So we manually and chemically clean and disinfect these canals, and then we seal it up with good sealers and something called as gutta percha, which is rubber like material. So as easy this might sound, this needs lot of patience, expertise, lot of costly equipment and material. Few cases can be very complex, and they might need almost around 3 appointments for root canal itself, and this should be followed up by the crowns.
Yeah, coming to the crown parts, people often neglect putting the crowns onto their teeth. Can you just briefly explain us what types of crowns are there and how this procedure goes on?
Yeah. So I've seen patients where beautiful root canals are done and they neglect once the pain is gone, and then they don't return. They return when the filling is gone, or either they break their tooth completely. And that time we have no option but to extract it. So all the money and time you've put into doing this root canal is gone to waste. So you have to put a crown, because once you do the root canal treatment, the blood and the nerve supply is cut. So the tooth is very brittle and weak. So the cap will ensure that it stays in your oral cavity for a long time. So they are metal crowns. They are porcelain fused metal crowns. As it is in the name, the porcelain is fused to the metal, where you cannot see the metal at all. It is covered by porcelain, and these two are generally handmade. There's something called as DMLS crowns, where laser is used to fabricate these crowns. And coming to the metal free ones, you have something called as lithium disilicate, and also the most popular zirconia. So these for these you need digital scanners. You scan your tooth, you make a file, you send it to the lab, and they'll design it for you, and the fit and the quality will be way greater compared to that which are made with hand.
And also, people are not aware that untreated gum diseases can also lead to root canal.
Yes. So generally where it starts is when you don't brush properly in few areas, the food gets accumulated and something called plaque is formed. It is a layer which consists of food debris, saliva and all, and if that is not cleaned, it forms into hard material called as calculus, and that pushes the gums down, and it exposes the root, which is supposed to be covered by the gum. It exposes the root, and it can cause sensitivity, and the infections can travel from that way and infect the root canal. So these are called as endoperioral lesions, and this way also once it gets infected, we have to perform root canal therapy.
Speaking of that, I've seen people opting for removal of tooth rather than getting a root canal done, as they are cheaper.
Yes, in that moment it can be cheaper, but in a long run when you want to fix it, it will be way more costly. So there was this patient where he got his teeth extracted 4 years before, and then now when he wants to replace it, the teeth have drifted, they've moved, the bite has changed, the way he chew has changed, and now to fix all of that, and there is no bone also. So to fix all of that and to replace tooth, it will be way more costlier. So as we have said, prevention is better than cure, and fix it up as soon as possible to reduce your costs.
Most people think of endodontist as root canal specialists, but your expertise go way beyond that. Can you just walk us through all the advanced procedures that people may not even know it exists?
Okay, so as we are known, root canal specialists, yes. So beyond that, what we do is we also place posts, which are mini rods, which we place in extensively destructed tooth. Then if there are persistent infections, we do endodontic surgeries, we do aesthetic restorations, we deal with minor dental traumas, and we are also proficient with microscopes and lasers, and we also do something called as veneers, which are porcelain or zirconia layers that we put onto our teeth to make it look very aesthetic, and smile designing. So all this comes under our expertise.
Yeah, obviously there's a lot of skill going on in this field.
Definitely.
And we can see social media pushing lots of DIY dental trends like natural remedies for cavities or natural remedies for tooth pain. So, what's your take on this?
Yeah. So I've seen patients putting on Zandu balm on your teeth for tooth pain. So Zandu balm is for your skin, not for your oral mucosa. Oral mucosa is very sensitive to the ingredients which are in that. There's something called as wintergreen oil in it, which irritates the skin and causes swelling. So that swelling takes almost 3 to 4 days to go down, and I would definitely not recommend it. Then one more thing we have is using cloves. So cloves, when you bite down on a clove, you release the oil. So clove oil is an obtundant, which is nothing but pain reliever. So it relieves pain temporarily, but in a long run, you have to get the treatment done. That won't help. So one more thing I can remember is using baking soda for whitening your tooth.
Yes.
So baking soda is actually very abrasive, and if you brush with it, only the external stains that which you have got because of coffee or turmeric or all the food, that will go, but it won't whiten your tooth. And it can also damage your gums because it is very abrasive, and you brush with it, it damages your gums, and it can bleed also. So I would definitely not recommend it.
And there are few myths also. Mostly, like people believe that brushing hard will clean their teeth.
Yes, I totally get it. I am here to tell you that please use soft bristles. Hard bristles are not efficient, they don't clean properly, and they wear down your tooth. Please use soft bristles. They'll clean properly, they'll go into the spaces where hard bristles can't go, and they'll clean better. And my mom itself doesn't accept using soft bristles. I understand you feel cleaner when you brush hard, but it is gonna wear down your tooth.
Yeah, totally relatable.
Yeah.
And people also believe that tooth removal or extraction can cause damage to the eyes.
The nerves supplying tooth and eyes are different, so
Yeah.
that is not gonna affect your eyes.
And even scaling may cause mobility of the teeth. And some people also think that it wears the enamel also.
So if your teeth are healthy and you have no gum disease, so there you can't see any mobility. If you have gum disease, removal of all the calculus will show the mobility which is already present. So there is no new mobility developing. But scaling can cause temporary sensitivity. So using a remineralizing toothpaste will do the job.
And many people believe that fluoridated toothpastes are toxic.
The amount of fluoride that is required to show any systemic effects is way more than what is in the toothpaste. So I would recommend everyone to use proper fluoridated toothpaste, brush twice, and then replenish your tooth with all the fluoride and make it stronger. Fluoride application is also recommended for preventing caries. So that is doing only good but no harm.
And do you think any advanced procedures will replace the traditional root canals?
So the traditional root canals, if done well, they'll stay in your oral cavity for almost 10 to 15 years. But it is a dead organ with no nerve and blood supply. So there is this concept called as regenerative endodontics, where they are trying to revitalize the tooth. It is nothing but the punarjanma of the tooth.
Yeah.
So they use various stem cells and some scaffolds like PRP. They use that to revitalize the tooth. But the studies state that the success rate is somewhere between 60 to 80. Research should be done in this area to make it more successful, but as of now, there are way too many factors that can go wrong and decrease the success rate. And one more thing that can replace root canals is that dental implants. Newer and newer technologies have come, many dental implants have come, and that can sure replace root canal.
Then this will be the game changer.
Yeah, definitely.
And have you encountered cases where ethics were compromised?
Yeah, we see cases like that. So there's one particular case that was he was almost 40 years old. He had come for some checkup. So I asked him to open his mouth, and when I checked, there are crowns on each and every tooth. Once we saw the X-rays, we have seen that all the tooth were root canal treated and crowns were placed. So I asked the patient, like, why did you get such an extensive treatment? He just told me that I had a problem in 2 or 3 teeth, and I went to this particular dentist, and he has done this. And the company where the patient was working in, so they were paying the charges for all the treatment. So this dentist decided that he needed all this extensive treatment and has done. That was pathetic, really pathetic.
Yeah, really pathetic.
So there was this one more case where the tooth was destructed. It needed root canal. The dentist did a root canal, but he didn't know how to place a post. So as the tooth is destructed, the crown won't hold. So what he did was he prepared the tooth for the crown, and as it won't hold because of all the destruction, he has involved the adjacent teeth also. He has given 2 crowns now. So there was unnecessary treatment done because you couldn't do the post. All I'm trying to say here is we are into healthcare business, and the healthcare should come first, business later.
Exactly. That's well said.
So I also urge the dentists to go do courses. If you don't know anything, it is no shame at all. Call the specialist regarding it or someone that is trained. Go do courses. If you don't understand once, go do it again. Practice on extracted tooth. Then go to the patients.
And how does a patient ensure that he or she is getting the best treatment?
So one thing patient can do is he can take multiple opinions and see how confident a dentist is, how confidently he's speaking, how sure he is about the treatment, and how experienced he is, and how he's answering your questions. And you can always ask for a specialist in that field. Suppose if you want to get a root canal done, you can ask for an endodontist. If you want to get braces done, you can ask for an orthodontist. One thing I want to tell patients is that don't bargain too much, because few dentists, they try to cut back on quality once you start bargaining. And fast, good and cheap. Only 2 things can come at once. If it is fast and good, it won't be cheap. We have to remember that.
Yeah, I truly hope that all the dentists out there do their treatments ethically. And at the same time, it's important to have awareness for the patients too.
Yeah, that is very important.
And what would you advise the young graduates who want to pursue masters in endodontics?
Okay, so pursuing masters is a tedious and very hectic job. If you're passionate enough, if you can afford it, I would urge you to go for it. And then if you are in it for the wrong reasons, if you just want money, there are loads of ways to earn money. Don't get into PG. You need a lot of persistence, patience, and mental and physical strength to, get through it. And then you can ask a lot of people, ask a lot of endodontists about their experiences, and you can search for various options. You can get into academics, you can go abroad, which country you want to go, and then you can plan it likewise. Don't just go into it because you want a master's degree. Research about it. If that fits into your picture, only then do it.
Yeah, that will be helpful for the graduates now. And this almost comes to the end of the podcast. I have to say that apart from being a skilled endodontist, you're also an incredible dancer and a certified Zumba instructor too.
Speaking about dance, we did dance together on our college fest
Yes.
days, and those were some memorable days there. So yes, I've been dancing from childhood. So I've danced in school shows, annual functions, and college fest. So dance really makes me happy. It is my therapy. So, and I never wanted it to go away from my life. And then one day suddenly I've seen this ad about Zumba instructor. So I've already attended Zumba classes. I've also struggled to lose weight, been in and out of gyms. So Zumba was kind of best of both worlds that was giving me. So there was this ad which popped up about the Zumba instructor, as I've told, And I was thinking on it for a while. Then right after my PG was done, I went and took that instruction class, and I became a Zumba instructor. So after watching a lot of YouTube videos about personal finance and how you should have different incomes with different streams, so I thought taking up Zumba instruction as a profession. So now I go to gym regularly because they're paying me and I can't sleep, I can't be lazy. So I go there, I dance my heart out, and I make people dance on my tunes. It has given me best of both worlds. So fitness is very important, and we should inculcate it in our daily lives. So Zumba is giving me fitness, income, happiness, and everything. And that's about it.
Yeah, even I truly believe that personal fulfillment is as important as professional growth.
Definitely.
And Dr. Reshma, thank you for coming all the way here.
It's my pleasure. And cheers to your first podcast and many more to come.
And feel free to reach out to Dr. Reshma on her Instagram ID for further dental treatments and guidance.
So for more informative and fun podcasts, do like, share and subscribe to Dual Take.
And that's Dr. Reshma Nooryne for you. I hope this episode helped you understand the importance of root canal treatments, how to maintain a good oral hygiene, and also when to visit a specialist. And as a dentist, I always emphasize on having regular oral health checkups for every 6 months. That can save you from major oral health issues. If you found this episode helpful, do like, share, and subscribe. And I'll be back with more valuable insights just for you.